this. Yes.
So is that your background? Have you ever experienced doing this? How did you choose that?
You said
Interrupting. I mentioned in my office.
And got drawn into.
Okay, gotcha, good, and you're learning.
And it kind of became my thing.
I was gonna let
introducing,
you guys. Our coaching coordinator.
well, I was just gonna say we could go around and say names while they're getting the
Okay.
technology set up. And I don't know, can the Zoom people hear us yet or not?
I think so.
Okay, well, we're gonna start with the people in the room, Zoom people, and then we'll come back to you, okay? So we'll just let you start, Jane, because you're right there.
All right, Jane Williams.
And she's executive director, and then we'll come down.
Debbie Karwoski, I'm a volunteer with jobs related stuff.
Tim Davis, I am Community Engagement Director.
David Wells, just kind of checking things out here.
Dan Ponder, I used to volunteer at Turning Point and mentored some people before just sitting in.
Conrad Hake, side-by-side coaching coordinator for Love Columbia.
Gary McNamee, I'm a new pastor at Grace Reformed Church here in Columbia and just signing up to be a career coach. So this is my first step.
Welcome. I'm Sasha Fisher, program coordinator for Path Forward. I'm Ashley Bowler, and I'm Carrie's assistant.
I'm Carrie Vogt. I'm presenting today, so you'll hear nothing back.
And I'm Rocky Albert, and I am a volunteer with Extra Mile Life Coaching.
I'm Kelly Van Doren, and I'm extra mile coordinator, coordinating the budgeting things. And also, I'm a first-time grandma today.
Oh.
6 pounds, 14 ounces, Jonathan.
Oh, way to go.
Okay, so now the Zoom people, if they can introduce themselves, if they can hear us and see us.
Here. I'm Linda Carl. I'm an extra mile coach.
Lori Dar, side-by-side career coach.
I'm Nancy Maddox, and I work with Jane on Wednesday morning, and I do extra mile and side by side, but not currently.
Okay, well, I just want to
Yeah.
say, all you Zoom people, you did a great job of talking. Is that someone else got to talk?
I can't read the chat. Can anybody read the chat from there?
Oh.
It says Rita Hicks says she's a nursing student. She doesn't have a microphone, but she's on Zoom. This is Bethany. I'm another service coordinator at Love Columbia.
All right, and I just think we should all give Conrad a big applause for trying to get all this technology going.
It's working, so that's good. Good news.
All right, so is
All
it
right.
Carrie's?
Yeah, Carrie, we'll turn it over to you and let you take over from here.
You have like a clicker or?
I'll have to click it from the back here.
Okay, okay. Hello, I'm Carrie Vogt. I work for Senior Benefit Services, and I have Ashley here with me today. What we do in a nutshell is we help seniors across Missouri with their Medicare. Just to share a little bit of my background before I dive into the topic today. You can go to the next slide if you want. I am a certified financial planner by background. So I used to work for an independent trust company here in town doing your traditional financial planning, wealth management type of services. And while I was doing that, I noticed a pattern among all of my retiree senior age clients. And that was that they were very confused about their Medicare. They were coming in with the same Medicare questions, paying certain penalties and premiums and surcharges if they were just unsure what they were, enrolling into the wrong plans. And it bothered me that they were seeking out their advisor for help and I couldn't really help them that much. And so it kind of lit a fire in me to want to do something about it, figure out why there's this general confusion. And really, in my opinion, it comes down to there's just a lack of education about Medicare. So I have a huge initiative to change that and help educate on Medicare. So that led me to finding Senior Benefit Services And over the last 2 years, I have been working with them as a licensed insurance agent, and I specialize in the senior market. And to talk specifically about SBS, if you want to go to the next slide. We've been around for 45 years. Our home office is here in Columbia, but we were founded in Trenton, Missouri. We are one of the largest Medicare benefit organizations in the Midwest. We represent 50 plus different insurance carriers. So what that means is we're an insurance broker. Because of my CFP, something that was incredibly important to me when I wanted to niche down this Medicare planning path was to make sure that if I'm talking to someone about their Medicare, we can truly be unbiased, keeping the client's best interest always at heart. Senior benefit services allow us to do that. Because right now, there's about 54 different insurance carriers in the state that have some type of Medicare plan, and we're licensed with all of them. It sounds really silly, but we meet with all of our clients face to face, or we try to through COVID. But the majority of people in the Medicare business function out of these big 800 people call centers out of Florida and Arizona, and there's no one local that you can go to face to face to ask their Medicare questions. And so our clients really appreciate that we meet with you not just once, but every year to review your Medicare coverage. Our services are free, just like any type of broker model. We get paid on the back end by the insurance carrier, so all of our services are able to be free to those that we're helping. We have 8 office locations around Missouri. Here are some of them. We also have an office out in Colorado and a couple of individual agents kind of around the United States, but our home office is here in Columbia. I'm going to go to the next slide. So you guys are probably wondering why are you here talking to us today? A lot of the people we serve aren't seniors. So yes, the majority of Medicare beneficiaries are seniors. There's kind of 2 big buckets of Medicare beneficiaries. And the primary one is those that are eligible because of age. We qualify for Medicare, we age at 65. That's one category. The other section of Medicare beneficiaries are those that are eligible due to some type of disability. So if you are receiving disability payments from Social Security for 24 months, on that 25th month, you qualify for Medicare. These Medicare and Medicaid eligible people are what's called a dual enrollee. They're dually enrolled in those 2 government health systems. And what that kind of looks like is if you go to the next slide. Sorry, can you sorry. Medicare is primary payer. And then Medicaid is secondary, or if you have some type of other insurance, Medicaid is the last payer. So the majority of these types of people have a low income status. So the goal is to have basically all of their health expenses paid for. There's no premiums. Whatever Medicare is going to pay 80%, Medicaid is basically to go back. Medicaid also provides these people not some premium assistance. So for instance, Medicare has a $150 a month premium for the Part B. And if you have Medicaid, Medicaid picks up that premium. The 20% co-insurance, Medicaid picks that up. The $1,400 deductible, Medicaid picks that up. And they also provide several prescription drug assistance, which is huge. I don't know if you can take prescriptions, but Ashley and I just met with someone yesterday. So literally, her prescriptions were going to cost her about $32,000. Now, that's a pretty dramatic example. Not everybody takes that. But if you do, and you have your well status, Medicaid is paying for that. So it's a great program. With that said, you want to go to the next slide. there are still missing pieces. So the goal, if you're a dual enrollee, is to have your health expenses paid for. However, there are three main pieces that cause people problems because they're not covered by either Medicare or Medicaid. Those three main services are dental, vision, and hearing. Some people, those aren't important to them at all. Others, those are pretty crucial to them. But what we find is that many in a low income status, teeth and vision just get neglected because it's up to you to pay for these things out of pocket. And so those just kind of get pushed to the back burner. And it can be a problem. And so Medicare realized this. And so they have developed what's called a dual Medicare Advantage plan. And is what I'm specifically here to kind of educate you guys on today. The Medicare Advantage plan is basically going to help a dual enrollee get some extra benefits. Want to go to the next slide.
And can the Zoom people hear fine? You to ask them?
Okay, am I going to talk louder?
Are you guys hearing okay online? Any questions?
There's a chat. Someone said that they can't hear very well. There's a lot of like microphone noises, maybe somebody that's, yeah, it's just kind of noisy.
Yeah, we can move it
background.
forward. Yeah.
Is that better?
Yeah, they made you stand quite close.
We're probably getting some packaging noises from lunch
Now I'm
too.
probably gonna be screaming. So to give you guys some numbers, in Boone County alone, there are 3,100 people that are fully eligible dual enrollees. So 3,100 people are on Medicare and Medicaid. Only 15% of those are enrolled in one of these dual Medicare Advantage plans. And go to the next slide. So that means there's roughly 2,600 people in Boone County that have additional benefits that they're entitled to, that they are not utilizing. And I'm guessing the majority of them don't know that these benefits are even out there.
Right.
And what they are. And so that number right there is why I'm here. I don't know, I met with Jane a few weeks ago, and I don't know why it took me so long to be here, because I have heard so much. My dad is Bob Shaw, he's on the board, some of you guys might know him. I've heard so much about West Columbia from him. I'm a member of the Crossing. I hear so much about what you guys do through them, plus just being in Columbia. You guys have done so much for the community, and it just dawned on me one day, I was like, you know what, I need to educate West Columbia about these services, because I'm guessing many of you might not even know that they're out there. So if you want to go to the next slide.
I have a question. So you explained this, but I don't think I was tracking. So if you're duly enrolled, does that mean you have to be 65
You do
and
not.
not?
So there's two categories. So to be duly enrolled, you could be over 65. But what qualifies someone to be duly enrolled is just if they have Medicare and Medicaid. And so some people that, if you're receiving disability payments from Medicaid for 24 months, then on that 25th month, you qualify for Medicare. So someone's Medicaid status after 25 months can qualify for Medicare.
And that would, so say that someone who's under 65, but they had a disability and that qualified them for Medicare care.
She, I think she was like 46. She had been receiving disability payments and she had been on Medicaid over 10 years. So she had been eligible for Medicare for quite some time because it had been way more than those 25 months that she had been receiving those disability payments. So for those 8 years or so that she had Medicare, you had no idea these plans were out there. Does that kind of answer your question? Yeah, okay. To explain what a Medicare Advantage plan is, if you go to the next slide,
Just a second.
I want to first just share what it means to be on Medicare. So there's lots of moving pieces to Medicare. But when I say the blanket term Medicare, someone is eligible for Medicare, I mean the government piece of Medicare. That's what, all of us in our working lives, our taxes, we're paying into the Medicare system. With our payroll taxes, we're paying into the Medicare Part A and B system. Part A is your hospitalization coverage. If you're an actual inpatient in the hospital, your Part A of Medicare coverage kicks in. Part B is basically all other medical. So if you're just seeing your primary care physician, or you need to see some type of specialist or have an outpatient procedure, that's your Part B that covers that. So someone that qualifies for Medicare has this red, white, and blue Medicare card. We can go to the next slide. Oh yeah, just to break those down a little bit further. So the Part A is your hospitalization coverage, like I said. Part B is the medical. You can see here how there are out-of-pocket costs associated with these. There's that $150 premium for Medicare, $1,400 deductible. Someone that has Medicaid, they're not responsible for those costs. A normal Medicare beneficiary that's on Medicare to 82 age, they're responsible for those payments. Next slide, please. So to clarify also on Medicaid, Medicaid is state run. Medicare is on federal level. Medicaid in the state of Missouri is called low cost Medicare. So when I say Medicaid, I'm referring to someone that has both of these government payers, Medicare and Missouri Health Net. Next slide. A dual enrollee has two options that they can use for receiving their health services. The majority of them choose the path on the left because it's all they know. They have the two government payers of Medicare as primary, Medicaid as secondary. On this route, if you are that inpatient in the hospital, your claims are actually being sent to Medicare, being paid by the government, and then they get shipped off to Medicaid, they pick up the rest. Sorry.
I had eating noises.
Sorry.
So I'm letting everyone know I stopped eating my carrots. And now Carrie is standing close to the microphone. so you
Sorry,
can-
I'm a talker and walker, so I'll try to stay put. The other option that is available to them is instead of having those two separate payers, it's replaced by one private insurance carrier that is offering you the same coverage that the government offers. They're required by Medicare rules to cover at least the same things that Medicare covers, but they can also offer additional benefits. And that's called a dual Medicare Advantage plan. Not to get too technical, but the government basically says, we're going to pay you X amount, these private insurance carriers have no idea what that amount is, but they're going to pay these private insurance carriers and they just say, we'll pay you X amount. You handle the claims with the member, cost us less money. So that's how these plans, everybody asks, well, how can you be $0 and have all that? They're getting their money somehow. It's from the government. Next slide. So, like I said, members will continue to have the zero cost sharing as with original Medicare and Medicaid, meaning there's zero premiums, zero deductibles, all of their services that are covered under Medicare and Medicaid. Go ahead and click to the next one. It's also covered on an advantage plan. So I took an actual just snippet here from a booklet of a summary benefits from one of these insurance carriers, one of these dual plans, showing how black documents for compliance sake. But everything that's covered under the government piece is also covered under the Medicare Advantage plan. But next slide, please. There's additional benefits. One more, sorry. what some of these benefits are. These are the 6 primary benefits that are huge additions to these people's lives that they're not receiving. The first is a $3,500 annual allowance for dental services. That person I mentioned last week who I helped, somebody referred her.
I referred to people.
Okay, was that awesome?
So
Thank
somebody
you.
came?
Yes.
Hooray!
She, oh my gosh, she was the kindest soul. She came to my office and we met, and she was telling me how, just embarrassed of her teeth she was. She was talking to me, covering up her mouth, saying she hates her smile, she's afraid to smile, how she's been so thankful the last year for masks because her teeth are covered. And it was breaking my heart. And anyways, I was sharing with her about these plans. And I mean, it brought her to tears knowing that she was going to have $3,500 to use on dental services. Like that was just something here. So the next one is a $400 annual allowance for glasses and contacts. There is a over-the-counter benefit. There is a $310 quarterly allowance that these members get to spend on what are considered over-the-counter items. Basically, anything that you can imagine going to a Walgreens to buy, they can buy with those money, that money. So some people that take a lot of, vitamins and supplements, they might not take prescriptions, but this is going to cover that. Or they can buy their toothpaste and toothbrush or shampoo. That $310 goes a long ways for those type of items, which ends up being a little over $1,200 per year. And if they don't use it, they lose it. So I always say, buy all the cotton balls, Band-Aids, and
Yeah.
another question I had was, does it roll over or is it? It doesn't. It rolls over quarter to quarter, but it ends at the calendar year. A wonderful new benefit that started in 2021 is that there is a $50 monthly allowance for healthy food items at a grocery store. Right now in Boone County, the participating grocery stores are Heidegger. And basically you sign up for a preloaded debit card and you get $50 each month to spend on its fruits, vegetables, dairy, meat, and grains. Yeah, that's amazing. I would love $50. The next one, my senior age clients are more excited about this one, but there is hearing aids are incredibly expensive, but there's a $2,000 allowance for hearing aids. And then lastly, they provide, just as an initiative to be proactive about your health, they will provide, they'll pay for your gym membership, which is a paid gym. So those are the 6 main additional benefits that these dual advantage plans offer that they are not receiving through their Medicare and Medicaid. I want to go to the next slide. Some things that are important to note about these plans. Just like, maybe the health insurance plan you're on right now. With the Medicare Advantage plan, you are confined to the doctors, clinics, hospitals within the plan's network. Some people, this doesn't matter to them at all. They're used to knowing that not every provider's office accept Medicaid patients. So typically, if they're used to going somewhere that accepts Medicaid, these plans are in that network as well. I've also had people just so excited about the benefits that think they'll switch all my doctors if they're not in the network. Step one is, before ever enrolling, making sure all the doctors you see are in network. These numbers are specific to 2021. Just again, like the health insurance plan you might be on right now, they're fiscally run. Deductibles might change from year to year. Benefits are a little bit different. So these numbers I share with you are specific to 2021. they don't drastically change each year, but, I just wanted to place over, they're not indefinite, that's just 2021 figures. Typically, these get better each year, for instance, like this year, we're using the 22 card. Probably the most important thing on this slide, and to really note is that only certain levels of Medicaid are eligible for these plans. So there's different tiers of Medicaid statuses that you can have based on income and assets. There's 8 of them. The majority of them are in about 3, but 4 of those statuses are eligible for these plans. And so, right now we know in Boone County, there's 2,600 that are fully eligible.
So is that higher income or assets that would not qualify? Is that what that would be?
I don't know what goes into the back end on the Medicaid side of it. All we know as far as Medicare eligibility is that these 4 acronyms are considered eligible. But it's, you guys might be familiar with the spend downs, so some people on Medicaid have a spend down or basically a monthly deductible that they have to meet before their Medicaid kicks in. People that are on a spend down, those can get kind of tricky. It's on an individual basis. Before they've met their spend down, they're not eligible. Once they've met their spend down, they're eligible. So it just depends on, I have some people that I meet with that have a $1,500 spend down. Probably not meeting that $1,500 spend down each month. I don't know why they've awarded you Medicaid, or because it'll probably never kick in, but some people have a $4 spend down. So as far as eligibility sake, there's not just one really blanket answer. It's very independent, and that just takes a little bit work on my side.
But most of our low income clients then would likely qualify.
Correct.
Okay.
Correct.
Most people would have one of the 4 that do align.
Correct. Yes.
Would you advise that we should try to be finding that out?
Yeah, and I'll talk about that on a couple of slides about how to check that status. I'm trying to think in the 2 years that I've been doing this, I've probably only met with 3 people that are on Medicare and Medicaid and haven't been one of those eligible qualifications. Last one on this slide is there are 4 different dual advantage plans in Boone County. These numbers I've shared today are just one specific plan. I chose that one because they have the most benefits for this plan year. Right now, there's 3 different insurance carriers, Humana, Anthem Blue Cross Blue Shield, and United Healthcare that offer them. I can go over the specifics of all of them, but I would have been here way too long. But they're relatively similar. Some, so like this one specifically had a really high dental and a lower vision. On others, it's black. Some have a really high hearing and a lower vision.
So you just target it to, when you meet with the person, you find out what are their needs and desires and target the plan.
Correct.
For them.
Absolutely.
So we don't even really have to know about it. That will just.
Absolutely, yeah, just that all of them have some type of dental, vision, and hearing. 2 of them have that food benefit card. But then also it can be dependent upon, it's only one of the plans will accept one more Medicaid status. So if I meet with you and you have that one particular status, well, there's really only one plan available for you. For the majority of people, it's all 4. Next slide. Last thing to note is that, like I said, there's 2,600 people not in Boone County not utilizing these benefits. Just because someone is eligible doesn't necessarily mean I'm going to tell you that that's the better route for you. The reason for that, and the people that this might not be a better option for, are typically those that follow in the more senior demographic, that are in some type of skilled nursing facility or have several pre-existing conditions, that are high frequent users of their health insurance. And the only reason I say that is feedback we get from, we talk with providers and hospitals and caseworkers, the feedback that they give us is that someone that's on the original Medicare, Medicaid, the government payer side, things just happen faster on that route than dealing with a private insurance carrier, which you wouldn't think the government would be faster. But it's backwards. So
Excuse me.
certain services or procedures might require prior authorization on your health insurance plan, the private insurance carrier. Just making sure you're, if you're waiting to be discharged from a hospital to go to a skilled nursing facility, making sure that skilled nursing facility is in network. That's all stuff that we do for our clients, but someone that's frequently in and out of the hospital or frequently in and out of the doctor, our experience is it's just stay put, because oftentimes if you're that ill, you're not even really going to be going to the dentist or going to the eye doctor
that's right.
or needing the extra benefits. So at
Right.
that point, just stay with the two government
Yeah.
payers that you have. But again, the majority of, as far as I'm aware, the people that you serve are typically younger. Like the person I met with last week, she was a just ideal candidate for a dual. She was pretty healthy. I don't even think she had a primary care doctor. She couldn't tell me last time she went to the doctor, but she really needed dental work. And the good thing with these, so everybody that's on Medicare, due to age, you are bound to very specific enrollment windows of when you can change and cancel and add plans. And it's only 8 weeks of the year between October 15th and December 7th. Somebody that's dually eligible, you can change every quarter. So, let's say someone joins one of these plans and they decide, or something terrible happens, they have a stroke, something unexpected, and they have all these medical issues that come up and they don't want to mess with getting these prior authorizations or whatever it might be. Just get out of the plan and go back to Medicaid. So that's one thing that's awesome for a dual person. And also good because like the person I met with last week, I could enroll her now. If she was just eligible due to age, I would have had to wait until October, and October would start January, wouldn't start until January. Versus her coverage started June 1st. I don't remember when I started doing it.
But they could be eligible for a marketplace plan or no? Or does that not overlap at all?
Like just straight from the ACA.
Right, yeah.
I don't believe you can be on Medicaid and the ACA because there wouldn't be a reason, because all the ACA plans are awarded based on. like,
Oh, that you,
how much
because you already have health
they-
insurance, right? Okay.
Yeah.
You're already covered by another
And so you're
provider.
already covered, so I
Okay.
don't know what they would, it wouldn't be beneficial.
Okay.
But I know we see expert writing. Next slide, please. One more. So how can we together help those people in Boone County that are dual enrollees? Number one is what I am doing here today, and that is education about these benefits. Whether it's, someone's eligible for Medicare due to age or it's disability, there is that general just lack of knowledge, lack of education about these benefits that they're entitled to. Even the seniors that I work with, half of them don't know that there are 20 other plans out there that they can choose from. And so to be a good advocate for your health insurance, you have to know all the options that you're entitled to. And so, I just am trying to take an initiative to educate about benefits that are out there and that they're entitled to and that don't cost them anything. Sorry, next slide. I thought I had it broken down. So step number one is educating those that are in front of the dual market, which I believe are some of you coaches that are sitting down face to face, hearing some of the struggles, financial struggles that these people face. And you know what, if it doesn't go any farther in this room, then this is at least 20 more people that I've educated. But maybe you guys are going to meet with someone who is really struggling, like Kelly's person that she met with their teeth. And maybe a light bulb goes off and you say, hey, there's maybe someone you could talk to. And so then the next step is educating that actual dual enrollee. Next slide. The next step is determining that eligibility. The way that we determine that is by verifying their Medicaid status. It's simply something that we look up on just the Mo Health Net website. There's 3 things you need to look that up, and it's date of birth, their social, and their Medicaid ID number. When I met with Jane last time, that can look like a handful of things. Kelly, she just gave, I believe she gave this person my number and she called my office and the meeting was happening. It could also look like maybe you emailed me and said, hey, here's someone's date of birth and social and Medicaid number, have that. Can you see if this person's eligible? And then tell you that information. So as far as how that process works, that's completely up to.
That's interesting. So I just thought of them contacting me, but I didn't know that we could, in the office, have them check it out so then they know we're seeing it.
I mean, when we can't just go straight to Mo Health Net and find out. With that same information.
You could, there are just so many
Nuances here.
nuances that I would hate for someone to get missed or to think that they're eligible and then they're not, and then they get their hopes up that they can enroll in one of these. And then they're not. So just for me, I guess, trying to be protective of that, it takes me 60 seconds. If I have the information, I can really back immediately.
We don't want to learn over new ones.
Yeah. And then, so if they are eligible, is it appropriate? Like I said, is this person in a nursing home? What's their health status? Do they have diabetes and COPD and AFib and all this stuff? And, maybe I'm just gonna say, let's not mess with this. And then at that point, if it is a smart decision for them, let's check your doctors, let's check your drugs, and then which of those 4 plans might be beneficial for you. And from there, next slide, this is just more of the service side of things that, me and my company do. We help with the actual enrollment into the appropriate plan, and review the plan documents line by line, the whole summary benefits, just like I met with her last week, reviewed line by line. These are all the dental services that you can use. These are the doctors and clinics that are in network. This is how you set up your Healthy Food Card. This is your over-the-counter catalog. You can go into Walgreens or Walmart, but you can also order straight from this catalog. It's having someone sit down and not just say, here are your benefits, but telling them how to utilize them. Otherwise, why enroll into the plan if you're not going to actively use them? And then, it's not just a one and done meeting. These plans are subject to change every year. Right now, there's 4 plans that are out there. Next year, there could be 6, or one of those plans could be better than the one they're currently in. And so, I have an annual review with all of my clients, whether you're a senior or Medicaid disability eligible. We have reviews every year to make sure that the plan that you're currently in still is the most appropriate plan for the upcoming year. The other thing we do, which is just, seems small on our end, but huge for someone, is to just be another advocate for them. If you're not in the insurance world every day, it can be daunting calling your health insurance and ask, do you know the right questions to ask, or you get a bill. So many people just get a bill from their doctor and they think it's right. They don't question it, they just pay it. But you have a lot of moving pieces here if you're on Medicare.
Or don't pay it.
You
turn to senior. Yeah.
And so
But don't pay it and be very stressed about it.
Right.
Not yet, I don't want it.
Yes. Well, and at that point, call me, verify, hey, I got this bill, can you explain it to me, or make sure, did you give them the right insurance card? Do they know you have an Advantage plan? Do they know? I think again, it's just making them a better advocate for their health. And then,
So how many of you are there? at the company?
Obviously, you want to be.
well, there are, so right now there's 4 agents in Columbia locally. But, you know, as a company, we've got 45 people nationally that all of it. But the last thing on this slide is the eligibility verification. So I think it depends on your status, but it's either once a year or once every 2 years. Medicaid also does a review to make sure that you still, you know, you didn't have an influx of assets, that you still qualify for Medicaid. And so, you know, I always tell my clients, if you get any letter in the mail for Medicaid, saying your status has changed, you need to let me know so I can give you a heads up that you no longer qualify for this plan. Or things like that, and just making sure that you're actually, they're truly so eligible for these. I believe that was, I don't know how I'm doing on time. Haven't taken a breath
I
here.
know, right? About 10 more minutes. And we can do questions.
Yeah, so what questions? I know it's a lot of information to throw at you, questions about Medicare Advantage specifically, these plans, needs, senior benefit services,
So
maybe kicking me, whatever your questions are.
So we should try to find out if someone already has the Medicaid, the dual advantage plan when they come, I guess. So then that would solve that if they do. Doesn't
Yeah,
sound like
I mean,
many
I don't
do.
know what all information you guys
We really
gather.
drill down probably that detailed about their Medicare, Medicaid specifics.
Okay.
So maybe you could help us ask some better questions.
Yeah.
Just to find out about that.
Ask
And
if
then this list of the 2,600 people, is that named? You actually know the names? I want to call them all. And I'm probably a volunteer who would help us.
I do not have them.
Probably some privacy issues.
Yeah.
Yeah. HIPAA.
Yeah, I don't know if the compliance is on that, but.
That's what I wondered.
Jane always wants to help everybody.
But no, I think finding out if they have Medicare, if they have Medicaid, and if they are already enrolled in the dual advantage plan, and now you guys know, hey, you've got this dual advantage plan, are you using these benefits? Do you know? Maybe they just enrolled because they saw a TV commercial. So many people know an advantage plan because they saw it on TV, or their neighbor has it. But do they know that they have that over-the-counter benefit? Are they actually using it? So, yeah, those would be, 3 things to find out. Are they enrolled in Medicare, Medicaid?
And one thing that's been maybe a tip off at times is we're doing coaching, career coaching, it doesn't necessarily fit as much because if people are trying to get work, they're probably not on Medicaid or Medicare,
Right.
or they might be on disability though. So they could qualify, but it most often seems like it comes up in budget coaching where we see somebody's receiving disability income or SSI, and then they also are paying for Medicare. And so is that usually a good indicator to say, hey, there's probably an option that you might qualify for something here?
If once they reach their 25th month of receiving that SSI, they should qualify for Medicare. It should be an automatic process. But yeah, they might not know. They might think that red button required they get in the mail is marketing, or they don't know that they have Medicare. So yeah, that would definitely be.
Well, does Medicaid automatically start paying that Medicare premium? Because that's what I think I've run into before, where somebody has both, but it's not paying for some reason.
Spend down, then they have to make that spend down. And again, it's going to be one of those certain statuses that I don't deal with on a regular basis, but it is possible because they're not eligible for these, most likely because they still have out-of-pocket costs that they're having to pay on their side of things. And so, yeah, they wouldn't be eligible for these. So I don't know those as well, but yeah, I am no Medicaid expert. So much of that is individual based stuff that they can't share with us because it's all determined based on their work history, income and assets, and I don't know the algorithms that go into awarding that. I wish they would divulge more of why, the last year it's been even more complicated because of COVID. They created this COVID exception. And so some people that had a spend down, these insurance carriers were raising completely and saying you're eligible for these plans. You don't have to meet your spend down. So then I just met with a couple about a month ago. They both have the exact same spend down. He was enrolled in one of these dual plans, and the language barrier, they were Greek, and she could not understand why her husband was in this plan and she wasn't. He had gotten in during that COVID exception and she missed it. And so it's just, I wish there was straightforward rules, but nothing straightforward. So.
In your experience, so let's say someone is 64 and they've got Obamacare paying substantial amount of premium, and they turn 65. Would they most likely move to Medicaid at that point, or what's your experience there?
So that's gonna, whether they're awarded Medicaid is still gonna be based on their income status. But if they're on
Comparable to Obamacare, I guess.
to Medicare,
Right.
so you actually can't be over 65 and on an open market plan.
Right.
Your only option is Medicare, unless you aren't in citizenship long enough or haven't paid into the Medicare system long enough. You're technically eligible, but you have to pay for Medicare.
Right.
Which at that point, I still think you have to pay for Medicare. I don't think you can even choose to be on it.
But you go from 64 to 65, would you end up paying more? Is a question that goes away.
Again, that's going to be dependent upon what they were paying for that Obamacare plan. Some people are paying $70 a month for it,
right,
because of their subsidies that they're granted.
Right.
I've had some people paying $600 a month for it. $600 a month, yeah, Medicare is way cheaper. But Medicare for traditional Medicare, your A and B, with the supplement and the drug plan, that's kind of the traditional Medicare path. A 65-year-old male or female is going to spend roughly $300 a month. Yeah. And that's here in the county.
So it's different for each county, premiums?
Depends on the plan. If it's a prescription drug plans or state-based Medicare Advantage plans or county-based supplement plans or nationwide. So there's lots of pieces of Medicare, and they all vary by demographics. Depends on which category.
Is there a similar plan in Williamsburg or something that you would recommend contacting for somebody that lives there? That's the right thing?
That's what we know. Williamsburg is.
Oh, I'm sorry, Tyler.
I can help them if they.
Yeah.
Or, oh, absolutely. Yeah, I mean, I've got clients in California, but all over. But
California, Missouri, or California? I should know how all over you were.
Yeah. Yeah, I've got clients.
If you can go to Paris and Mexico and California.
That's right.
But no, we have the 8 different office locations, so I totally get it. Someone wants, they need to, in office. There are.
We were just talking about Green County, so I just wanted to make sure I didn't refer somebody.
Yeah. Yeah, no, absolutely.
Awesome. Yeah. And I'm surprised you didn't know Williamsburg because there's 60 people that live there.
Do people have any questions?
Yeah, if you're on Zoom, do you have any questions for us or for Carrie? I mean,
I have one. I'm interested in knowing how coverage works in the Advantage Plan when you're out of area, out of state, maybe even out of country.
It's gonna depend on the plan. So some of them are HMOs, meaning you have in-network coverage only and out of pocket or out of network is 100% out of pocket. PPOs, some of them are, regional. The network is much broader and you're gonna have some network, out of network coverage. But because a Medicare and Medicaid, traditionally, you're only going to have coverage if you go in network. That's just a better way to put it. Or you're gonna have out of pocket costs. That's the downfall to joining, whether it's a dual advantage plan or a regular advantage plan. Your coverage isn't gonna be as great out of network. So, if I'm someone that spends a lot of their time traveling, an advantage plan isn't, in my opinion, the best option for you. There is one of the insurance carriers, they have a passport is what they call it, where you can, it takes a little legwork on the back end. If you're traveling, let's say you're in Dallas, Texas, you can, client call me, say, hey, I'm going to Dallas, Texas, can you tell me what hospitals and clinics are in network in that area? If for some reason something happens to me, you can passport your coverage to that area you're going, and I'll tell you, these doctors are in network. So if something happens, go to this hospital and we'll be like, this is right here. So kind of depends on a plan that you can do it. But I don't know if you asked about out of the United States, but foreign travel is not covered.
Does it fall along the lines, like from my experience with ACA plans and with children's Medicaid, is that typically there are a couple of plans that have Boone Hospital, a couple of plans have university, but there's not a lot of crossover between those two. Is that the same way with the dual advantage plans?
Two of the carriers will cover both.
Okay.
And if there are any other questions, and my email, my cards are in here, feel free to email me any questions that come up, or I mentioned to Jane last time, I am more than happy to come here and meet with someone. By all means, I can come to my office, but I also, I also work with a lot of financial advisors, and I meet with their clients in their offices. I work with a lot of banks and go to the banks and work with their clients there. So I'm used to being all over. So if you guys are meeting with someone, it's easy for me to come here and see if one of these is a good option for them.
Good job. I appreciate what you've given us.
Oh, absolutely.
Yeah.
Thank you for allowing me to
Thank
be
you
here
for
today.
becoming passionate about things.
Nice to see you, Dean.
Yeah, see you later. See you. Thanks for inviting me.
Don't wander around on the other side, anybody that hasn't.
Yeah, we were talking. Well, I got to the last time.
Yeah, yeah. Well, just a little tidbit is actually dating.
Jane, Kelly, or Conrad, can you hear me? This is
Yes.
Nancy on Zoom. Can Carrie give her email and her number? Because all that was on her slides was an 800 number and the sbcsteam.net website, and looking on it, it's hard to find Carrie.
Yep. I will,
Well, Conrad could maybe just email it out as a follow-up.
Do you mind if I send the slides out to our coaches group?
I think that's fine.
I just want the number, but email's fine for the number and email for her.
Okay.
Yeah.
It is a 1-800 number, correct? That's your office number?
I can give you I have a direct work line as well.
Okay.
It's 5382527.
I'll put it in the chat, Nancy.
Okay, and the email too for her. What's the area code for the 825?
573.
Okay.
I'm putting it in the chat, Nancy.
All right, thanks, Conrad.
Could really help a lot of people. Yeah, to be aware and really just figuring out the screening questions, or maybe if there are, is there an actual pamphlet about dual advantage? In general, I know there are different providers.
I was gonna say there are, United Health and the Rail template.
Right. I just know that even to show someone the concept,
Right. We can do that to some extent, but I was trying to, before this meeting, ask the marketing department even. But because each of the benefits vary, I couldn't say there's $3,500 general benefit, because that's not true for all of them.
Or maybe just something that says there is a dual advantage. You've got straight Medicare, Medicaid, and then there's dual advantage. That we could let people know.
Yeah, if that would be
or just
helpful, I think
something-
my own work on that.
Yeah, I think that was something that we can show to people.
Okay.
I think just to start the conversation. Just the conversation would be, we just want to make sure that you're in the right plan for you.
Right.
And then maybe there's an option you don't know about. But,
I will work on that.
yeah, that would be helpful, I think.
Okay.
I
will get those.
And then we are definitely going to send people to you.
Well, I'm happy to help. Whether it's you guys or the one you're helping, but.
Yeah.
Yeah, well, I appreciate you guys allowing me to come talk to you guys. today.
And when's the baby due?
August 31st.
August 31st.
So, yes, it does.
This is your first?
Second.
Oh, my God. We're going to be very busy. We're going to a lot of.
I'm trying to remember.
Yeah. Yeah, so we want to take these.
Last week.
True.
Okay.
And I think we're meeting
with somebody.
Oh, okay.
Yeah, it'll be here tomorrow.
Oh, really?
I've never